Hello, welcome to Health Professional Radio. I'm your host, Neal Howard. We're in studio today talking with Dr. Thomas Lee, Chief Medical Officer of Press-Ganey. He's also an author, recently published An Epidemic of Empathy in Healthcare, How to Deliver Compassionate, Connected Patient Care That Creates a Competitive Advantage, published by McGraw-Hill. Welcome to Health Professional Radio today, Dr. Lee.
Thanks for having me.
Thank you. Now, you've been working to improve the patient experience, not so much as it relates to the actual hands-on care and the prescription meds or the treatments or the therapy. How important is that today as opposed to before?
I think that my colleagues, there's so much we can do now that we couldn't do, 20, 50 years ago. We focus on what can we do. And that's very often the question that physicians like me are asking, is there anything I can do? A lot of times that really isn't the big question. And, I think when you ask patients what really matters to them, when they're old and when they're frail and when they're dying, it's really other issues. Like how many days are they going to spend at home in the last month of their life? Issues like that are more important to them than have we got the potassium in line or the hematocrit above 27?
But when you're in medical school, I interview quite a few healthcare professionals, and they all say that we don't get a whole lot of training in nutrition. Isn't it the same when it comes to, caring about some of these things that family members or social workers or hospice care should be caring about? I mean, you're the physician. You're there to heal them, to get them as comfortable as possible, as best as you can. Or is that something that needs to change?
I think part of it is education, but I think part of it is, people in healthcare, their attitude toward the work. Empathy is work. It's emotional labor. It's mustering the energy to look right at someone, look them in the eyes, and think, what is important to this person? What's really going on with them? And that takes energy, and it takes especially great energy in an era where, your Apple Watch is vibrating and you can hear, clicks from text messages and emails coming in, and, there are 4 people waiting for you. Mustering the energy to focus on people, giving people attention. That's really a precious thing these days, and we need to create an environment where people, feel they better focus and help them focus.
Creating an environment. Are you talking about legislating an environment, or collectively as an industry? Creating this environment?
I don't think legislation can create the environment that we need in healthcare, and I also don't think financial incentives can do it either. I think this is, these are intrinsic motivations, but we need an environment where our intrinsic motivations come to the surface reliably, not just when we feel like it, but for every patient. And that's why, I'm a big believer in transparency. I like what the University of Utah and a lot of other medical centers are now doing, which is, they're putting all of their patient experience comments up online, as well as the data, but the comments in particular, good, bad, and ugly. And what that does is it makes every physician remember that it's a high-stakes interaction when they're talking to a patient. They're actually 10 times as likely to write a positive comment as a negative comment, but there's an accountability that there might not be otherwise with every single patient.
Now, you're the author of An Epidemic of Empathy in Healthcare, How to Deliver Compassionate, Connected Patient Care That Causes a Competitive Advantage. As the author of that book, tell us how does someone considering going into healthcare as a physician, or maybe in some other aspect, how do you find that inner empath and determine that this is the right path for you? Because if you're going into a profession because of the money, how do you reconcile empathy when you're really in it for something else? And how do you identify that when you're in school?
Well, I think, one of the great things about healthcare is that almost everyone goes into it because they want something more than money. They go into it because they want their life to be about something that makes them proud. Mm-hmm. They want to help people. They want to feel good about themselves. And I think that's always been true of medicine, and I think it's still true, and it'll always be true. You hear a lot of disgruntled, health professionals, physicians in particular, saying they wouldn't go into it today. Mm-hmm. But then when they talk about what their kids are going into, mm-hmm. when one of their kids is going to med school, mm-hmm. they're incredibly proud because in their hearts they know that there's nothing better. And so I don't think you should go into healthcare if all you care about is money. But then, how do we create an environment where, physicians and other healthcare professionals can feel proud reliably about what they're doing? That's part of the challenge, is to create an environment where they can be at their best and then be appreciated for being at their best.
We spoke a moment ago about the impossibility of legislating this environment that you speak of. Okay, let's say that every physician goes into it, as you say, to make something better, to mean something, to make a difference, and not necessarily for the money, although, it's nice to have bagels or whatever, when you want them. Would you say that certain changes or certain existing practices, and procedures, and laws tie healthcare professionals' hands when it comes to getting time to be empathetic out of thin air, when you have to be on the computer, or you have to, you're spending 5-10 minutes with a patient max, and you've got 30 or 40 or 50 or more to see that day?
Well, we have a lot to figure out in healthcare, and certainly, before I got on this call, I was using my electronic medical record, playing catch up with all the things going on. The problem isn't the electronic medical record. The problem is that there's just so much stuff going on. What the electronic records do is it brings you face to face with all that's going on, and it's overwhelming. I don't think that the solution is going back to the old days where we simply did less in medicine. I think the solution is organizing better. And my own feeling is that real teams, multidisciplinary teams that are working really well together to take care of groups of patients with similar needs, I think that is the solution to the chaos of medicine for patients. And I actually think that's the solution to the burnout a lot of clinicians are feeling. I think they feel proud when they're working in teams that are delivering excellent care. So I actually think teamwork is the solution for the future, not getting rid of electronic medical records or something like that.
Now, as we wrap up, Doctor, what type of reception have you gotten from your fellow healthcare practitioners from your book, An Epidemic of Empathy in Healthcare? What type of reception are you getting?
Well, of course, I may be biased because, no one's going to say really negative things right to my face. At least I haven't so far. I've been hearing a lot of positive things, in fact, which is that we're talking in this book about things that resonate with healthcare professionals' noblest values, the way they want to see themselves, and the question about how do we create a business context in which clinicians can be the kind of person they want to be and that their patients are hoping that they're going to be. They find that very useful, interesting, and important.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio this afternoon with Dr. Thomas Lee, Chief Medical Officer of Press-Ganey, a company that surveys hospital patients. And we've been here discussing his recent book, An Epidemic of Empathy in Healthcare, and also discussing an environment where physicians focus their time, attention, and empathy on patients rather than having to focus so much on the rules and regulations of the practice or of the industry as a whole. It's been great having you here with us today, Dr. Lee.
My pleasure.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.